Everyone has stress in their daily routine. The alarm clock didn't go off. There's a long line at the coffee shop. Rush hour traffic. You have to cram for an important exam. You're not prepared for this work presentation. Your kids are sick. This bill is overdue. You just want to go to bed and forget any of this ever happened. There is so much stress that many of us think this crazy rat race is just, well, just life. It's true that a little bit of stress can be good, but when there's so much stress that you're always in a panic, it can have a negative effect on your health.
Stress has direct physical effects on the body. It's definitely related to muscle tension, so it tightens up your muscles so that if you do have pain anywhere, so for example, if you have low back pain, when you're under stress, your muscles are going to tighten up and you're going to feel the pain more. Stress plays a major role in hypertension and heart disease, GI problems, certainly pain, but even in diseases like cancer. Stress has been linked to the progression of tumors. So that's why it's so important to learn how to manage stress effectively.
How do you know if you're experiencing too much stress? There are a few signs: excessive moodiness and irritability, depression or feeling overwhelmed, aches and pains, intestinal problems such as nausea or constipation, decreased libido, behavioral changes such as eating more or less, sleeping more or less, or an increase in nervous habits. When these small signs crop up, that means it's time to evaluate the stress in your life, especially how you're managing your stress. Introducing a few changes to your life can be all it takes to control your stress and also prevent any stress-related illness.
Well, the number one recommendation for stress management is physical exercise. You have to exercise on a regular basis. Of course, if you're not exercising, you need to first see a physician to make sure that you can do what you need to do. Physical exercise has been shown to release endorphins in the body, and it's been shown to really help with stress and with depression. So that's the number one recommendation.
After physical exercise, we recommend exploring relaxation methods. This can be anything from deep breathing to guided imagery, self-hypnosis, or meditation. These are all things you can do right where you're sitting.
Well, meditation allows you to really relax. It definitely can lower your heart rate, lower your levels of muscle tension. It allows you to take time off for yourself, to kind of separate yourself from the world, and it's almost like you're putting a buffer between yourself and the world. One image I like to use with patients is that you're putting on armor around yourself, kind of like a knight, and everything just bounces off of you, and it doesn't have to pervade inside of you. It just kind of bounces out there so that you yourself are kind of protected from stress.
A big part of stress is control. Oftentimes, the things that stress us the most are the things we can't control at all. An individual can't control the traffic or the weather or the mood of an irritable boss. Stress management in all its forms is about taking back some control in little ways.
The purpose is really to gain control over yourself, to gain more control over your body. It's also to prevent any levels of, it's to prevent the effects of stress. When you gain more control over your body, when you learn how to relax yourself and how not to allow stress to affect your body, you're gaining control. You're learning how to lower your heart rate. You're learning how to prevent illness and disease. You're learning how to prevent hypertension, which is probably, the biggest silent killer out there. So you're learning how to live a long, healthier life.
How we react to stress is influenced by many factors. The first is your natural fight or flight response. The second is your individual genetic code, which contains a gene that influences your stress reactivity. Some people are naturally laid back about everything, while others are naturally wound up about everything. We see these behaviors even in infants. The third is learned behavior from your environment. If you had parents who were relaxed about things as opposed to parents who were anxious, that's going to influence how you react to stress. You can't change evolution or biology, you can't even change your parents, but you can always change your reaction. By doing that, you can regain control of your stress. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.